Welcome to the latest edition of Endocrinology Updates, covering breakthroughs in the past 2 weeks. Brought to you by Lucid Quest. Diabetes UK highlighted a new NHS pathway for children with early-stage type 1. The pathway covers confirming autoantibodies, setting a monitoring cadence, deciding when to start insulin, and how to handle single autoantibody presentations. It also points families and clinicians to evaluation materials. The intent is practical: intercept risk sooner, support families with clear steps, and align services for future screening programs. Hamad Medical Corporation expanded bone health services. The package includes more specialist clinics, advanced diagnostics, and a fracture liaison service that coordinates post-fracture care. The focus is earlier risk stratification, appropriate initiation of approved osteoporosis therapies, and structured follow-up to cut secondary fractures. Avant Technologies and SGAustria announced a joint venture and license agreement aimed at encapsulated stem cell-derived insulin-producing cells. The plan includes a US vehicle, Insulinova, with funding directed at early clinical work. The goal: address type 1 and some insulin-dependent type 2, with a cell-based modality that sits alongside current drug and device options. Public Health Wales research informed new support for people living with type 2 diabetes. Planned features include a digital support hub, clinician packs, updates to the NHS Wales app, and expanded peer networks. The aim is day-to-day self-management that is easier to start, simpler to sustain, and more connected to clinical teams. At the AHA Scientific Sessions, with a JAMA paper, the PERMET trial reported that metformin did not improve the 6-minute walk distance in peripheral artery disease without diabetes at 6 months versus placebo. Secondary outcomes were also neutral, and safety was similar. For prescribers and payers, this calibrates expectations and may shift choices toward therapies with demonstrated functional benefit in this population. EMA advisors at CHMP issued a positive opinion for teplizumab to delay progression to stage 3 type 1 diabetes. The recommendation is based on placebo-controlled data showing longer time to onset. A European Commission decision is next. If approved, it introduces competition in prevention stage therapy, with likely implications for pricing and formulary access. The FDA signaled plans to remove black box warnings on many menopause and perimenopause hormone therapy products, both estrogen-containing and combination, citing updated risk-benefit, understanding and availability of non-hormonal options. The change is intended to reduce undertreatment while keeping safety guidance aligned with current evidence. The European Society of Endocrinology revised its adult hypoparathyroidism guideline. Chronic post-surgical disease is now defined at 12 months. The document outlines an algorithm for when to consider PTH therapy after conventional management, which supports more consistent escalation decisions. Stay ahead in endocrinology research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare